Back to our channel. Today we are going to start the general features of femur. So femur is a thigh bone and it is the longest bone in our body and also the strongest bone of the body. So like any other long bone, it also has two ends like upper end and lower end. If you see the upper end, you will find the head, you will see the greater trochanter on its anterior aspect and lesser trochanter on its posterior aspect. So one thing we need to find, like, what is the anterior surface, what is the posterior surface. So just see the greater trochanter and the head of the femur, then you can find it as an anterior aspect, whereas the posterior aspect has a lesser trochanter. So just by lesser trochanter you can find out it's a posterior aspect. Of course, we will now see the side determination. This is just a trick, but the side determination is the upper end mainly bears a rounded head, and whereas the lower end is widely expanded to form two large condyles, that is the medial epicondyle and the lateral epicondyle, and the head is directed medially, of course, and the cylindrical shaft is convex forwards. If you see the cylindrical shaft, it's convex forward. Okay, now coming to the anatomical position, the head is directed medially upwards, slightly forwards, whereas the shaft is directed obliquely downwards and medially, so that the lower surfaces of the two condyles of the femur lie in the same horizontal plane. So these two lower surfaces lie in the same horizontal plane. Now coming to the upper end, now mainly discuss about the upper end. So this is the upper end and this is the anterior surface of upper end and this is the posterior surface of the upper end. So the upper end mainly of the femur includes the head and also the neck and also the greater trochanter and the lesser trochanter. So and also there is an intertrochantic line. So you can see this is an intertrochantic line, okay, and intertrochantic crest. So remember that intertrochantic line is on the anterior surface of the femur, whereas the intertrochantic crest is in the posterior side of the femur. Okay, so one more thing, intertrochantic line is nothing but the line which is between the greater trochanter and the lesser trochanter. On the anterior side, then it is called line. On the posterior side, between the greater trochanter and lesser trochanter, you have the intertrochantic crest. So once again, let us revise this. Very simple. It has head. Head is always, of course, located medially. It has a greater trochanter, it has a lesser trochanter, and in between them they have the intertrochanter line in the anterior surface. On the posterior surface, they have intertrochantic crest between the greater trochanter and lesser trochanter. That's it. So zebra anterior and posterior surface upper part. Okay, now coming to the head, we'll talk in detail of head. Head forms a more than half of a spear. It is more than half of a spear. The spear should be up to like here only, but it's somewhat more. Okay, and it is directed medially upwards, slightly forwards, and of course it articulates with the acetabulum to form the hip joint. And the roughened part is situated just behind the center of head. Here will be some roughened part. In real bone you can see that and you can also touch it. Okay, so that roughened part is situated behind center of head. That pit is called fovea. Here will be some fovea. Okay, so here you can see this diagram, this is the fovea. In the middle of the head only you will find that structure. And as coming to the blood supply, the smaller medial part of the head near the fovea is mainly supplied by the medial epiphyseal arteries. So as it is medial, you can remember like that, medial epiphyseal arteries supply it. Okay, and these are mainly derived from posterior division of obturator artery and from the ascending branch of medial circumflex femoral artery. Of course, about blood supply we will see later. Once again, just like revision it would be, so the medial part of head, or especially near the fovea, is supplied by medial epiphyseal arteries, and they are derived from the posterior division of obturator artery and also from the ascending branch of medial circumflex femoral artery. So these arterial twigs enter the acetabular notch and then pass along the round ligament to reach the head. And one more thing, the round ligament is also present in this fovea of head. Okay, now let us come to the larger lateral part of the head. So this is the medial part, this is the larger lateral part of the head, and this is supplied by lateral epiphyseal arteries, which are derived from retinacular branch of medial circumflex femoral artery. And this set constitutes the main supply, and damage to its results in necrosis of head following fractures of neck of femur after epiphyseal fusion. So the lateral epiphyseal arteries anastomose freely with the metaphyseal arteries. So when you go to arterial supply, then we'll understand this in detail. Okay, now come back to again our normal general features. So coming to the neck, this is the neck. The neck connects, of course, the head with the shaft. Okay, and this is about 3.7 centimeters long, and it makes an angle with the shaft The neck shaft angle is 125 degrees in adults. So 125 degrees in adults, that is the angle between the neck and the shaft of the femur bone. Okay, and it is less in females due to their wider pelvis, and the angle facilitates the movement of hip joint. It is strengthened by thickening of bone called calcar femoral, which is present along its concavity. So this neck is mainly strengthened. The angle facilitates the movement of hip joint. This angle 125 degrees facilitates the movements of hip joint, and it is mainly strengthened by thickening of bone called calcar. Here there is thickening of bone mainly due to calcar femoral, okay, which is present along its concavity. Now coming to the neck. The neck has mainly two borders and two surfaces. So two borders, two surfaces. So what are those two borders? The upper border, you can see this is the upper border, which is concave, horizontal, meets the shaft at the greater trochanter. Okay, and it meets the shaft at greater trochanter. The lower border, coming to the lower border is straight, oblique, and meets the shaft near the lesser trochanter. Okay, the anterior surface is flat. This is the anterior surface, and this is flat. It meets the shaft at intertrochantic line, right? And it is entirely intracapsular. This whole structure is intracapsular. The articular cartilage of head may also extend to this surface. Next, coming to the posterior surface. The posterior surface is convex from above downwards. So it is convex from above downwards, okay, and concave from side to side, of course. Concave from side to side. It meets the shaft at the rate of an intratrochantic crest. So that is the difference. On posterior side, intertrochantic crest. On anterior side, intertrochantic line. Okay, this is the major difference. And meets the shaft at intertrochantic crest. Only a little more than its medial half is intracapsular. Only here some part is intracapsular on posterior side, but on anterior side more than half its part is intracapsular. Okay, here only some part is intracapsular in the posterior side, and it is crossed by horizontal groove for tendon of obturatus externus. Okay, next coming to the angle of femoral tension or angle of anterior version. It is formed between the transverse axis of upper and lower ends of femur, and it is about 15 degrees. There is an angle of femoral torsion or angle of anteversion, and this is formed between transverse axis of upper and lower ends of femur. Okay, and it is 15 degrees. Now coming to the blood supply, the intracapsular part. This intracapsular part of neck is supplied by retinacular arteries, and this is derived mainly from trochanteric anastomosis and produce longitudinal and the vessels produce longitudinal grooves and foramina directly towards the head, mainly on the anterior and posterior superior surface. So the extracapsular part of the neck is supplied by ascending branch of medial circumflex femoral artery. Okay, this about this arterial supply we will all study later, but for people who have already studied it, it will be like a revision. Okay, now coming to the greater trochanter. So if you see, this is the greater trochanter. The greater trochanter is large quadrangular prominence located at upper part of junction of a neck with the shaft. The upper border of trochanter lies at the level of center of the head, and the greater trochanter has upper border with an apex. So it is having an upper border, and this is called the apex of the greater trochanter. Okay, so here you can see it's upper border, and this is called as apex of the greater trochanter. Okay, and it has mainly three surfaces. One is the anterior surface, one is the medial surface, and one is the lateral surface. Okay, and the apex is the intern posterior part of posterior border. Remember, the apex is posterior part of posterior border. So you can see here, this is the posterior aspect, this is the posterior part or posterior border, this is the apex of the greater trochanter. Okay, and anterior surface of the greater trochanter, you can see it is rough in its lateral part. Lateral part means this is medial part, this is lateral part here, right? So lateral part is rough in the anterior surface, and the medial surface presents a rough impression above and deep trochanteric fossa below. So deep trochanteric fossa below, here will be the deep trochanteric fossa. Okay, and the lateral surface is crossed by oblique ridge directed downwards and forwards. Now we'll start about lesser trochanter from this diagram. Okay, so the lesser trochanter is actually a conical eminence. You can see it is directed medially and backwards and from junction of posterior inferior part of neck with the shaft. Okay, so this is a lesser trochanter. So whenever you see lesser trochanter, this side will be posterior side. This side you can see it is like hiding, so this is the anterior side. Okay, you see this is a posterior side. You can see the lesser trochanter is located medially on the posterior side of femur. Okay, now coming to the intertrochanteric line, this is the intertrochanteric line, right? It marks the junction of anterior surface of neck with the shaft of the femur. It is prominent roughened ridge. Okay, it is a prominent roughened ridge which begins above at the anterior superior angle of greater trochanter as a tubercle, and it is continuous below with the spiral line in front of lesser trochanter. So in front of lesser trochanter it will be continuing here like this. Okay, and the spiral line winds around the shaft below lesser trochanter to reach posterior surface of shaft. So that one only, this intertrochanteric line only start here on the anterior surface, and it passes near to the lesser trochanter, and it will come on the posterior side as a spiral line. Okay, now about the intertrochanteric crest, this one on the posterior side it is called intertrochanteric crest, right? So this intertrochanteric crest marks the junction of posterior surface of neck with the shaft of the femur. It is smooth rounded ridge which begins above at posterior superior angle of greater tubercle. Here posterior superior angle of greater tubercle. Okay, and ends at the lesser trochanter. It is rounded elevation a little above its middle, and this is called quadrate tubercle. Actually it begins at the above at the posterior superior angle of greater trochanter and ends at the lesser trochanter. So from here it is ending at the lesser trochanter. Okay, and it has a rounded elevation little above its middle. This one, this rounded elevation in the middle, this is called as quadrate tubercle. Okay, so now it's time to talk about the shaft. Okay, the shaft is more or less cylindrical and it is narrowest in the middle. This middle part is narrowest and it is more expanded inferiorly than superiorly. Okay, and it's convex forwards and it is directed obliquely downwards medially because the upper ends of two femora are separated by width of pelvis and the lower ends are close together. And in the middle one third of the shaft it has three borders. So now first we'll talk about the middle one third. It has mainly three borders. So mainly on the posterior side in the middle you will see the linea aspera, and this linea aspera sides will form one line, that is the medial side. You can say head side will be medial side, this is medial side, and this is lateral side. So on the posterior side you will see well marked, that is linea aspera. Okay, so now let us see what are the borders. So you can see this is the medial border and this is the lateral border. Okay, this is the posterior border of course, and this is the anterior side, just anterior surface. So only three borders: medial border, lateral border, posterior border, that's it. Okay, so three borders. And what are the three surfaces? This is the anterior surface, this is a medial surface, this is a lateral surface. Okay, done. And the medial and lateral borders are rounded and ill-defined, but the posterior border is in the form of broad roughened ridge called linea aspera. The linea aspera has distinct the linea aspera have distinct medial and lateral lips. The medial and lateral surfaces are directed more backwards than towards the sides. And in the upper one third of the shaft, the two lips of linea aspera diverge to enclose an additional posterior surface. Okay, thus it has four borders, that is the medial border, lateral border, and the spiral line. And also there is lateral lip of gluteal tuberosity. So lateral lip this side, this one is called lateral lip of gluteal tuberosity, and it has four surfaces, namely one is anterior surface, one is medial surface, one is lateral surface, and another one is posterior surface, this one. Okay, so gluteal tuberosity is a broad roughened ridge on the lateral part of posterior surface over here. Next, coming to the lower one third. So this is the lower one third. In the lower one third, the shaft also has two lips of linea aspera diverge as supracondylar lines to enclose additional popliteal surface. Thus this part of shaft has four borders. One is the medial border this side because head is there, so this is medial border, this is lateral border. Okay, and Next you have the medial supracondylar ridge and you have the lateral supracondylar line or ridge, and it has mainly four surfaces. One is of course anterior surface, this side, medial surface, lateral surface and popliteal surface. So the medial border, if you come to the medial border, the medial border and the medial border and medial supracondylar ridge line meet inferiorly to obliterate to the medial surface, this one. So they both meet to obliterate the medial surface. Okay, now coming to the lower end, now we will talk in detail about lower end. The lower end of femur is widely expanded to form two large condyles. One is the medial condyle, one is the lateral condyle. Okay, one medial condyle and one lateral condyle. Anteriorly the two condyles are united are in the line with the front of shaft. Okay, so posteriorly they are separated by deep gap formed the intercondylar fossa. So this fossa is called as intercondylar fossa, which is seen mainly on the posterior side, and intercondylar fossa is also called intercondylar notch, and it projects backward much beyond the plane of popliteal. Now let us talk about the articular surface. You can see below, these are the articular surface. So there are two condyles are partially covered by large articular surface, which is divisible into patellar and tibial part. So the anterior side, if you see this one on the anterior side, this is the patellar surface, and the posterior side you can see this is the tibial surface. Okay, so patellar surface covers the anterior surface of both condyles and extends more on lateral condyle than on medial condyle. So this patellar surface is extending more on the lateral condyle on posterior side. Okay, and between the two condyles the surface is grooved vertically and it is separated from tibial surfaces by two faint grooves. The tibial surfaces cover the inferior and posterior surface of two condyles and merge anteriorly with patellar surfaces. Both also merge anteriorly with the patellar surface. Okay, and the part of the surface over lateral condyle is short, straight anterior posteriorly, and the part over the medial condyle is longer and curved with convexity directed medially. So about lateral condyle, it is flat laterally and it is more in line with the shaft, and it is takes great part in transmission of body of weight to the tibia, though it is less prominent than medial condyle. It is stouter and stronger, and the lateral aspect presents a prominence called lateral epicondyle upon it, and the popliteal groove which lies just below the epicondyle. So just below the epicondyle you can see the popliteal groove. Okay, and it is deep, it has deeper anterior part and shallower posterior part. So deeper anterior part, shallower posterior part. Next there is a muscular impression posterior superior to epicondyle. Here will be the muscular impression. Coming to the medial condyle, so the medial condyle is convex medially. The most prominent point on it is called medial epicondyle, this one, and the posterior superior to epicondyle there is a projection of adductor tubercle, and this tubercle is important landmark. The epiphyseal line for lower end of femur passes through it. So epiphyseal line for lower end of femur passes through it. Next coming to intercondylar fossa or intercondylar notch. This separates the lower and posterior parts of two condyles. It is limited anteriorly by patellar articular surface, anteriorly this one by patellar articular surface, and posteriorly by intercondylar line. Here will be the intercondylar line which separates the notch from popliteal surface. This is popliteal surface, this is notch. So it is separated by intercondylar line. So by this we have completed all the general features of femur. In next video we will discuss all the attachments of femur.